This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hi, everybody. My name is Roman. I'm one of the Schwab Chief residents. This is Zev. He's a future class of 2053. So meet him now. It's nice to meet all of you guys who are here. So we'll get, give me a second to make sure I can get the screen share to go. So it should be going. And I can get right into our presentation. See if I can, perfect. So yeah, Schwab Rehab, we're associated or affiliated with UChicago and with UIC and with Mount Sinai, but we're a freestanding rehab hospital. We'll talk about our rotations, educations, benefits, who the residents are, all that good stuff. But we'll start with sort of our byline or mission. It's in the part of Chicago that's what a lot of people will call underserved, and meaning it's a poor neighborhood. There's a lot of racial disparities, a lot of social justice issues, a lot of social determinants of health issues. So we're really looking for people that are kind of willing to stand out, that care about that are they're willing to put the effort it takes into really caring. And that has been recognized by the Baldwin Award is sort of the program equivalent of the Arnold P. Gold Foundation Award. So that was a nice way to be recognized in that way, and we're very proud of that. So let me flip then to a video we made that will do some of the talking for me. Here. Can everyone see the video on the YouTube screen?
Yeah, you have it pulled up.
Okay. Is the sound going through also?
No, that's not coming through as well.
The sound isn't coming through. I don't know how to make the sound go through. Let's see. Control apps. Can you hear this guy munching on his cracker?
Yeah.
Share computer sound. Maybe let's try that. Thank you for bearing with me in some. Let's try that again.
Hi, my name is Michelle Gittler, and
You guys can all hear Dr. Gittler introducing herself here?
Yeah, that's better.
Okay, great. So then I'll let it run. It's just a couple of minutes long.
I'm the program director here at the Schwab Rehabilitation Hospital. And welcome. We're thrilled that you're interested in our program. I'd love to tell you a little bit, and I know you're going to hear a little bit more from everybody else at Schwab.
We are a 3-year advanced ACGME accredited PM&R program. In your PGY 2-year, you will work with Dr. Kopp on the brain injury service, Dr. Lee on the spinal cord injury service, Dr. Mecki and Dr. Kreis on the stroke service, and Dr. Greif on the general/COVID recovery service. You will also work outpatient in our specialty, spasticity, and pain clinics. In PGY 3 and 4 years, you will do consults at Mount Sinai Hospital and at the University of Chicago, where you will also do pain medicine. At the University of Illinois, you will do EMGs, MSK, and sports, and you will do pediatrics at Shriners Hospital.
I've been here for 29 years, and I wouldn't be anywhere else. The things that keep me at Schwab are working with you as residents because it keeps me learning.
We have 3 inpatient therapy gyms, an ADL room, aquatherapy, an amazing therapeutic rooftop garden, and recreational therapy with some incredible rec therapists where anything is possible. At Schwab, we like to have fun while at work. While we're on call.
Happy birthday to you. Happy birthday, dear John Jack. Happy birthday to you. Blow out the candle.
And outside of work too.
What makes Schwab different from all of the other great programs out there is that we understand the importance of social conscience and advocacy as we learn how to practice rehabilitation medicine. In fact, our residents came up with our byline or our motto of being a program of diverse residents that embody social conscience as we practice rehabilitation medicine.
Schwab is a safety net rehabilitation hospital with residents and clinicians that focus on social conscience. We're also the only recipients of the 2020 ACHME DeWitt C. Baldwin Jr. Institution Award that recognizes programs exemplary in fostering a respectful, supportive environment for education and delivery of patient care. We hope to see you soon at Schwab, and please meet some of our amazing faculty and staff.
Come join us. I look forward to meeting you, and feel free to reach out with any questions.
Great, so let me get out of there real quick and get back to the presentation. If I can figure out how to get there. Or screen sharing. There. Let's scroll back. So that's us in a nutshell. Most people who start here, like at most other programs, will have done a prelim year in internal medicine, gen surge, family medicine, and then we're a 3-year advanced PM&R residency with all those services: brain injury, spinal cord injury, stroke, etc. while we're inpatients. And then our PGY 3 and 4 year, we do a lot of outpatient rotations like musculoskeletal medicine, sport medicine, spine, pain, electrodiagnosis, neuromuscular spasticity, consults. We won't go over too much about the fellowships. We're usually 50-50. There's people who have gone into all of these fellowships in the before, and there's plenty of people that choose not to. There's some information about us. We're a freestanding rehab hospital, facility on Chicago's west side. We've got 92 beds, clinics, outpatient therapies, a pool. We rotate at U Chicago in addition to Schwab. We rotate at University of Illinois in addition as well. And our yearly anatomy review that we do at University of Chicago. All rotations are 10 weeks total, but for the most part in 5-week blocks. But then we come back. So it's nice to be able to see something, do something else for a minute, and then come back to it and reinforce those skills with things we've seen before and with things we've seen since then. Outpatient, there's continuity clinics, spasticity clinics, wheelchair evaluations. It's a lot of fun stuff. We work at North Shore as well as North Shore Hospital System. That's out in the suburbs. It's a different patient populations, hospital structure in a different way. At UChicago, we will do consults as well at Mount Sinai. We go to Elmhurst for a general PM&R rotation, where we're seeing a lot of things from injections to more EMGs, MSK medicine, a little bit of sports. So it's nice to be able to see a breadth of different practice settings of EMRs and ways that rehab can be practiced. This is a brief overview of the different facilities that I just mentioned. UIC does have Division I sports coverage. So when we're there, we do see and treat some of the athletes there as well, which is a very cool thing. It's a very different setting for a lot of people, like one of our residents, John, who just sent in his applications for a sports medicine fellowship. EMGs, we work on as well, interventional spine. The PGY 4-year, right now there seem to be more like 5-week blocks. We have a little bit of time to get back and see if we want to do more inpatient stuff again, if that's something that we're interested in, or we can tailor the experience rather to what we're interested in. So there's a lot of flexibility in addition to the elective time to make what we want out of it and get the experiences that we want. We have no issues hitting any of these numbers. There's really no worries or concerns. Everyone manages to get it and more, and then some. Protect the time every week for didactic lectures. Plus, on most days, we have a lunch and learn, kind of more informal learning sessions. We'll do journaling clubs. CSI is a version of a sort of thing, M&Ms or morbidity and mortality, and we discuss cases that have happened, how we can improve. Everyone does a quality improvement project. I mentioned we do a physical anatomy lab at UChicago focusing on neuromuscular medicine, which is very, very useful and cool to be able to do that again. We got plenty of vacation time. We have plenty of flexibility for those of us with families or without families to do things we need to do. For me personally, the rotation schedule was, and we moved things around. So for people getting married, for people having things they need to do, so everything's flexible and just talk to each other. And we have a Costco budget, so we have a fully stocked pantry and fridge, as you might have seen in that video, which is a definite plus to have. These are all of our inpatient attendings that we work with after crisis, and some of our outpatient attendings as well. And this is the current list of residents. So that's in the top right. Henry Guan is also on this video, somewhere in one of those boxes, as are Dr. Benjamin and Dr. Gittler, who will introduce themselves in a little bit. And then we try to have fun beyond our work responsibilities and having a healthy environment at work. We make a point to be friends and do things outside of work as well. We're supporting each other. A couple of people are running the marathon in Chicago this year, so there's going to be a lot of us are coming out to support them, fundraise, and we just hang out in general. So that's pretty much what we have for this presentation. If any of you have any questions, please go right ahead. I know Dr. Gittler and Dr. Benjamin, you wanted to introduce yourselves and say a few words as well.
Well, I'll start. Hello again. I'm Michelle Gittler. I'm the program director. Of course, I'd love to thank the PM&R Scholars for enabling this, and thank all of you for taking time out of a beautiful summer evening to hear a little bit of not just about our program, but all of the rehab programs. As I said in the video, all these programs are really, really good. And your job is to figure out which program is going to make you the best you, which program, and it's different for everybody, but which program is going to help you develop into the physician that you're proudest to be. Again, what differentiates our program is we squeeze a little social justice into everything that we do. And you may get tired of hearing about social determinants of health and issues that impact the people we serve, but that is what we do. And we want to do it great. we don't want to just be okay at it. I think you've seen that we do accept audition rotations. You can feel free to reach out to any of us with questions. I'm just thrilled so many of you are going to go into rehabilitation. Look forward to meeting you.
Hi, everyone. I'm Cheryl Benjamin. I'm the Associate Program Director. It's nice to meet you all. I'm so happy to see such a nice turnout. That's great. Thank you, PM&R Scholars, for having us here. We really appreciate it. As I mentioned in the chat, if anyone has any questions, please feel free to reach out at any time. We're also fortunate to have our Medical Student Clerkship Director, Dr. Teresa Lee Namath, who's here as well, and I'm sure she's happy to answer any questions. I see Dr. Guan has come on as well. He's our advocacy and outreach chief. He's actually on call right now, so that's why you see him on the phone. But if you have any questions, please feel free to reach out or private message in the chat or message for everyone in the chat. But thank you.
5 minutes.
Does anyone have any questions? It looks like there's a question regarding the EMG training at Schwab. And so our PG3s and PG4s complete 10 weeks each of EMG in different environments and work both at the University of Illinois, Chicago, as well as at Schwab, participating in the EMG rotation. They also participate in EMG on their neuromuscular rotation at the University of Illinois. And there is no issue in terms of ensuring that the ACGME guideline recommendations are met in terms of reaching numbers. It's a very robust rotation.
I was just going to jump in and say that somebody asked a really important question about the challenges that we face with the population we serve. And I do want to be very straightforward that it's quite challenging. There are challenges regarding housing insecurity, food insecurity. We have a number of persons who are undomiciled or they have inappropriate housing. There are issues. We work with all kinds of persons who've had interaction with the criminal justice system. And in fact, we're the only rehab hospital that takes care of the Department of Corrections, prisoners from the state of Illinois, and detainees from Cook County. So the challenges are what you see in populations that often get overlooked, in populations that don't have voice. And it just means that you are going to take your time and take a deep breath to understand that people don't plan to not take their medicine and resultingly have a stroke because of uncontrolled hypertension. You know, and people, little kids, 5, 6, 7-year-olds don't dream about growing up and getting shot and being paraplegic. And people with diabetes don't hope that they're going to have limb loss. You know, catastrophic things happen to people because this world is really hard for many people. Our responsibility, our privilege is to work with people, hear their story, and figure out how we help make it better. It is hard sometimes not to be judgy, but I can tell you that each evening as I'm trying to leave, I hear the residents talking about the medicines that are covered under someone's insurance plan, or talking with a consultant about changing a medication because a patient can't get it, advocating for patients to get training for, you know, their diabetes medication, advocating for an extended length of stay because they've got to get up 2 or 3 flights of stairs, and we just need a few more training sessions with the family. When you work with the populations we work for, you know, you're not going to get a big fancy present, but you're going to have people recognizing that you're changing their life with them. And it's pretty incredible. It's not easy, but I mean, I love it, and I hope you'll love it too.
Thank you. If any of you have any additional questions, please feel free to put in the chat or reach out. We put our emails in there as well. We also have a great residency website, so please check it out. There are links if anyone wants to do audition rotations. There's links for us to be able to chat with you as well. So thank you again, PM&R Scholars.
Thank you, team from Schwab.